Thank you, Matthew. Good morning, supervisors. Good morning, community. Matt Willis, Public Health Officer. Today's COVID-19 update. Albro, if I could have my slides, please. The main issue I'll be addressing today is our vaccine distribution plan, which really is our primary strategy right now. I'll go over some of the numbers in terms of our cases, and then touch briefly on some of the progress we've been making in schools. Next slide, please. So I'll be sharing some screenshots just to remind the public that this is all available on our website at coronavirus.marinhhs.org. And the website continues to be revised and updated. So this shows that we've added a few elements to our homepage, including the number of total people who have been vaccinated thus far in Marin County. And you'll see that as a daily update. In addition, we've also added the number of deaths in the county to this tool. Next, please. And this is our epidemic curve showing that we've seen a continuous decline in cases since our mid-January peak. There has been a slight uptick in cases just in the past few days. That's right now too early to know whether or not that represents a trend, but in the context of increases in cases we're seeing in other parts of the country and the region, something that we'll be keeping a very close eye on. Next, please. We are moving from tier 2, the red tier, into orange. As we had anticipated, our case rates are now 2.5 per 100,000 residents per day, which brings us well below the 4 necessary to move into the orange tier. So we are now in our second week of orange tier numbers, and we'll be moving into the orange tier with regards to our policies tomorrow. Next, please. And just to remind everyone what those policies are, we have been here before. Retail and grocery is open at 100% capacity. Indoor dining is 50%. Movie theaters and museums are 50%. Houses of worship and weddings and funerals will also be 50% indoor capacity. Gyms and fitness studios are open to 25%, and we've now are able to open indoor pools. Bars that don't serve food can now be open out of doors, and non-essential offices can now be opened for people to come into work, although we still recommend that people work remotely as much as possible. Higher education has been added now to the orange tier capacity at 50% for indoor lectures. And then forecasting out in the most optimistic frame, I think importantly, our goal really should be to maintain our status in the red tier. In the orange tier as we are entering that tier now, but to forecast out the next tier, if we continue improvement, will be the yellow tier, which requires less than 1 case per 100,000 residents per day. And the earliest we could enter that would be April 14th, given that we have to have at least 3 weeks in any one tier before we move to the less restrictive tier. Next, please. This is how we're doing with regards to our countywide vaccination plan. We have passed the number of 100,000 residents that have been vaccinated in Marin County, with 47.5% of our adults. We're counting only those adults in the denominator, because obviously only people above age 16 are able to be vaccinated, because the study did not include anyone under age 16. So if we look at all of our residents above age 16, about 212,000. So we're almost half of those have been vaccinated so far in Marin County with at least 1 dose, and about 25% have been fully vaccinated with 2 doses, with 151,000 total doses administered, remembering that for most it's a 2-dose regimen to be fully vaccinated. Next, please. And this shows that our vaccination rates remain among the highest in the state. Next, please. And then this has been added to our public website. You'll be able to see our vaccination rates by age group, with 1 dose and 2 doses. And this will just continues to be updated daily as we make progress. And it will include both age groups and racial groups, just so that everyone can see how we're doing to make sure that we're applying a health equity approach to our vaccine distribution plan. What this shows is about 75% of our residents age 65 plus have been vaccinated, and about 40% of our residents age 35 to 64 have been vaccinated. That younger age group will continue to grow, most dramatically, because that's the age group we're now vaccinating as we bring on people with medical conditions and other occupational categories that qualify them as eligible for vaccines. Next, please. So I thought it would be important to share with you what we're seeing in terms of the time frame now. We had hoped to have all of our residents vaccinated by the end of June. At the current pace, it looks like we're actually going to be ahead of schedule for that goal. Right now, we're at 3,700 per day average vaccines. These are doses, not people, but total doses across all of our systems. So this is our Kaiser Permanente, Marin Health, Marin Public Health, which does the greatest fraction of all the vaccines in the county pharmacies and other places people are able to get vaccinated. Total is almost 4,000 per day average, and we expect that to increase as more supplies arrive. If we say we have about 100,000 remaining unvaccinated adults in Marin County, and we assume that the future doses will be a mix of 1 and 2 dose regimens as we get more of the Janssen product, the Johnson & Johnson, which is a single dose regimen, and then the other 2 dose regimens. We would estimate this 54 days at that current pace to complete vaccinating all of our Marin County adults above age 16. So that would be mid-May would be the anticipated completion date, and sooner as supplies increase. And then thinking ahead, children, because the phase 3 clinical trials are just starting with children, are underway, it won't be likely until summer or fall before we would actually have the emergency use authorization to vaccinate our children. And this is an important point, because as people are concerned about the tiers and who is able to be vaccinated and who's eligible versus whom, and who's jumping the line or isn't jumping the line, these kinds of questions, I think, become less acute as we all recognize that, within less than 2 months, it's likely that all of us will have a chance to be vaccinated. So the relative difference in time is not as great as we had thought it might be. Thank you. Next slide, please. So with the progress in decreasing case counts and increasing vaccinations, what can still go wrong? We are, and this is really an important point, I'm always hesitant to be, overly celebratory in our tone, because I don't want people to assume that the coast is clear, that we can let down our guard. In fact, we are still at risk as a community, and that little slight increase in cases we've seen over the past few days is a sign of that. So one, concern is that mask fatigue and breakdown of non-pharmaceutical interventions, that's all the things we've been doing every day in our lives, facial covering, social distancing, avoiding indoor gatherings, are still critical. Especially travel right now is something that we're seeing more and more of, and does carry risk, especially with the emergence of variants that are occurring in other areas, especially the B.1.1.7 variant is a particular concern to me as public health officer, because it is more infectious as a variant, and that's been clearly demonstrated as it's traveled across Europe and now other parts of the United States. Michigan, New Jersey are seeing relatively dramatic increases in cases, primarily attributable to B.1.1.7. So this is not the time to travel. Second thing that could go wrong would be pockets of immunologic inequity that can sustain transmission. So our strategy is really to make sure that every community has the opportunity to be vaccinated, that all barriers are removed. And that's been core to our strategy, because if there are any pockets where there's multiple, groups of people who can interact where the disease could be transmitted, we all remain vulnerable. And then the emergence, as I said, of more transmissible or less immunologically susceptible variants is a threat to all of us. And then importantly, as much progress as we can make as a community in Marin, or even as a state, or even as a nation, we need to take that into the context of the fact that this is a global pandemic. This started in a village in China and spread across the globe. And we are all part of the global community. And right now, most countries don't have nearly the access to vaccines that we do. About 3% of the globe is vaccinated. And so we will need to be, once we move through our own success, maybe by mid-May, we'll need to be focusing on the international picture, both locally and as a nation. Next, please. So I'll end with just a summary of what's happening in schools. We are now at 100% of our schools in Marin County are open to some form of classroom-based learning, with a total of 11 suspected in-school events of transmission with over 1.5 million student days accumulated in Marin. So this has been one of the silver linings of our pandemic response in Marin. Next slide, please. And importantly, the CDC last week released guidance that's going to help us move from all of our schools being open to some form of classroom-based learning to perhaps removing those last barriers to full-time in-person learning for 5 days a week for all students. And that is that they have reduced the distance recommended between students to now to be at least 3 feet between students and classrooms, moving from 6 feet in Marin. We had been applying a 4-foot standard. The CDC is now allowing us to use a 3-foot standard, which may seem like a small difference from 4 feet to 3 feet, but actually makes a big difference in terms of the number of children you can get into the classroom. And most conventional classrooms, virtually all conventional classrooms, are able to get normal amounts of children, conventional amounts for pre-pandemic days with 3 feet distancing, as long as other facial covering and other routine measures are in place. And then remembering 6 feet when children are eating, when they can't wear their masks, and 6 feet between the adults and the students. CDC also clarified the importance of ventilation, which we've already talked about with our school community. Fortunately, with windows open, our ventilation requirements can be met just through simple interventions like that. And then they removed the recommendation of physical barriers like plexiglass in favor of just the facial covering and hand washing, et cetera. Next, please. So in summary, COVID-19 transmission continues to decline in Marin. We know that reopening brings risk and responsibility. We've been here before. Our vaccination plan is on track. There remain many unknowns regarding our pandemic path, and we will need to be following the data very closely, and we'll be revising our policies as necessary. And the next 4 weeks are pivotal as we move towards vaccinating a greater share of our most vulnerable residents and trying to stay ahead of the variants as they're spreading across the nation. Next, please. Thank you. That concludes my presentation.
Thank you, Dr. Willis. Bring it back to the board for questions. Supervisor Conley.
Thanks. Good morning, Dr. Willis. Great report. As always, you answered a lot of my questions already, but just delving a little bit more into vaccines. So a lot of folks are aware that seemingly doses are made available to people who can kind of drop anything to get a vaccination to a vaccination site on short notice. How are we ensuring that those who are working without an ability to get to the site at the last minute during a work day or the like also have opportunities to get vaccinated? For example, are sites open in the early morning or evenings? How are we dealing with that situation?
Yeah, there's the sites are different hours at different sites. The ferry terminal site is open till 7 in the evening, so it actually we've framed it later in the day to allow access for people after work. Similarly, the site in the canal area at the Kerner campus is open evenings and also weekends to make sure that people who are in the Latinx community in the canal, especially who may not be able to access the site during regular business hours, can get to that site that's in walking distance of most in the canal. So yes, there's a variety. And then at the Marin Center, that's more conventional business hours. But between all the vaccination sites we have, it really covers regular hours, weekends, as well as evening hours.
Great, and you mentioned we could be in the yellow tier as soon as April 14th. Right now, the yellow tier is essentially the ceiling for any potential business operations. Has the state offered any insight on their thinking about what happens after a county has been in the yellow tier for over 2 to 3 weeks? In other words, and maybe we're thinking fairly optimistically here, when would restrictions be lifted altogether?
Yeah, I mean, that's a great question. And that's a real crystal ball question, I think. Right now, again, I think our goal should really be trying to maintain the gains we've achieved in the orange tier. We are one of very few counties in the state that would have achieved the orange tier at this point. So we are ahead of most. The yellow tier is less than one case per 100,000 residents. So we'd have to really be doing our best. So, the way to earn that status will be for people to continue to, cover their faces, not travel, not gather together indoors. So it's inconsistent if people think that they can engage in those behaviors and also hope to achieve the yellow tier. Those things will not happen at the same time. But the yellow tier, yeah, so the yellow tier would be 3 weeks away at the very earliest. I'm just signaling that in terms of the rules of how the state regulations occur. I think it is optimistic to assume we would be moving that forward that quickly, especially given that we've sort of stalled out at our current like mid orange tier numbers. The state is looking at the green tier is the hope. If we're able to get everybody vaccinated by mid-May, who can be vaccinated or is willing to be vaccinated, and hoping we have very high vaccination rates, at least 80%. And the variants are the vaccine provides protection against the most common variants. It could be that summertime would be a lot rosier than we had anticipated to be. The president has signaled that July 4th, maybe where we get together for barbecues on July 4th and that kind of thing. I'm gonna hold the hope that's a reality for us in Marin County. But I think, again, there's so many wild cards in terms of the two biggest wild cards are people's own behavior and the variants.
Thanks.
Other questions? Yes, Supervisor Rice.
Yeah, just really quickly, and good morning, Dr. Willis. Thank you again for the work and for supporting the community. Any concerns about the variants that we're seeing sort of rock and roll Europe and we know are present here, but I'm just wondering in long term how comfortable you're feeling with our vaccination penetration and speed, and is that going to be the buffer we need to keep these variants from really getting hold here?
Yeah, that's a great question. My sense is this is kind of a neck and neck race. And that's why I say that, for the next 4 weeks are going to be pivotal. The variants, for some reason, and it's not exactly clear why, California has been relatively spared with the B117 variant that is more common and has spread much more quickly across Europe and other parts of the United States. Right now, we're looking very closely. I check every day in terms of the percentage because I'm watching for that to increase. Right now, we went from 4% B117 in the state of California to about 6%, and it can take off more quickly. At the same time, we have about half of our adults have been vaccinated in Marin. We're doing almost 4,000 a day. If we can stay ahead of that, we may, and fortunately, that variant, the vaccines that we have, the Pfizer, the Moderna, and the Johnson & Johnson all perform well with regards to that particular variant. So if we can get our people vaccinated before that variant really takes a foothold, we may stay ahead of this and dodge that. But I do think it's that close. Right now I can offer more of an update to the board next week on the surveillance we're doing around variants and the sequencing that's happening, because I think it is increasingly important. We're getting more and more work with the laboratories to look at the sequences of our strains in Marin and across Northern California. The California strain, which is the B1429, 1427, is now a variant of concern, and that's more than 50% of our cases across Northern California are now what's called the California strain. Fortunately, that variant doesn't seem to actually confer any increased virulence. It's not more deadly. It doesn't increase rates of hospitalization in any significant way. So that's fortunate. But the B117 variant again is the one that's hot on its heels, and that's the one I'm more concerned about.
And hence the reason why it's still so important that we're doing the masking and the social distancing, especially for those who haven't been vaccinated yet, but really everybody, because it's really those are our tools that make the difference. If we don't let the virus spread, it can't get a foothold.
Exactly. Yes. Thank you for echoing that.
That's it. Thank you.
Supervisor Moulton Peters, any questions? Supervisor Arnold? Okay. So Matt, I just wondered if you could just update us on how we're doing vaccinating essential workers, how that's going. And then the second question is, we don't seem to be making much of a gain in the 65 and older group. That number's been relatively constant over the last few weeks. And are you concerned about that?
So the reason that the number hasn't changed, the number has actually changed for the 65 plus. It's a statistical issue that we're using a different denominator so that we are trying to align the way we count this with the state. And it's a detail that I was not aware of before this, that there's different ways that the counties, the number of individuals in different age groups is counted. There's the Department of Finance has one, that the American Community Survey has another one, the US Census has another one. And depending on the one you use, you actually have different estimates because they're projections. And so we've actually moved to a projection that has a greater number of assumed people in those groups. So it actually kind of shrunk our percentage. So it's a statistical reason. We are continuing to vaccinate more and more older adults. In terms of our essential workers, the primary strategy, and this relates to maybe a future conversation in this agenda for item 6, which relates to My Turn and how the state will be moving to the My Turn platform. Our primary strategy now is to have our registration platform allow for entire days of vaccinations at our vaccine operations, like the Marin Center pod, where we can do 1,200 vaccines a day, have an entire day dedicated to people in certain sectors where we're actually able to invite people in a protected way. So we invite food service workers, we invite teachers, we invite people from low-income communities in a protected way so that we can make sure that they're keeping up and that they're not having to compete with everyone who has computers and cars and other, more easier access. So that's kind of our primary strategy, and it's been very effective at getting people into our vaccine clinics. And that's what we're continuing to do. This week we have 3 vaccination days at the Marin Center dedicated to people who live in our lowest HPI, our lowest Healthy Places Index census tracts, which is essentially our lowest income communities, as an example of that strategy.
Thank you.